Today's topic is risk segmentation. What is risk segmentation? Generally, insurance is based on the concept of risk pooling. In general, risk pooling, sharing the potential costs with a large group of similar risks. That's how the insurance companies able to maintain the premium based on the risk sharing. What does similar risks mean? It means grouping the people with the same health status, and you can base the premium on a similar health status across the spectrum. As a consumer, as a consumer, you have a right to be grouped with others who have similar health risks. Good or bad, it doesn't matter. Good or bad. Only then you will be able to get relevant and timely information, appropriate level of coverage, and proper medical care at affordable insurance premium. Affordable insurance premium. That's very important. It has to be affordable insurance premium. When I say segmentation, they need to be segmented into four categories, folks. Four categories. Let's look into this, what these categories are. Number one, well category. Majority of the Americans are in well category. Roughly around 68% of Americans are in well category. There are no claims, low risk, good nutrition, healthy, active lifestyle. They don't see the doctors that much. They never go to the hospitals. So they are in the well category. Their claims roughly, if you include in well category, there are only 12% of the claims, folks, out of that 63%, not 68, 63%. What is the next category? At risk. At risk, an acute condition. When people smoke, they have a high blood pressure, they are overweight, they are prone for risks. We all know that. And they need to be segmented into at risk, and their premiums have to be based at risk. And this is not happening, folks. Right now, the insurers are basing the premium on a broad category. They're not segmenting like it's supposed to be. They should be at risk, they should be categorized at risk, and their premiums have to be based at risk. If we look at the at risk, the claims are comparatively at risk. The number of 20% of the population is at risk. This group generates 25% of the claims, folks. 25. This group needs like smoke cessation, diet support, nutrition, education, prenatal care, and family planning. They can lower the premiums by taking precautions and following preventive measures and early intervention. So at-risk category is number 2. Whereas in the 63% of the well category, as I said earlier, there are only 12% of the claims, whereas in 20% of the population at risk, their claims are 25%. So the premiums have to be based on that. What is the next category? This is where most of the costs are. Chronic illness category. Chronic illness. If you really look at total population of people with chronic illness is 16%, folks. 16%. Those with chronic persistent illnesses or diseases need a significant medical care. They do. And this group benefits most from the medical maintenance and stabilization. Those with asthma, diabetes, heart disease, mental health issues they can lower their premiums by following treatment plans and be compliant with doctor's orders. It's as simple as that, folks. Even people with chronic illnesses, you can lower the premiums if you follow certain taking precautions. Only 1% of the population, what is the last category? Only 1% of the population are exposed to catastrophic impaired risk. 1% of the population, folks. This group health risks deserve every possible help and support. This group generates 15% of the health care claims. 1% of the population. This is the last category, which I'm talking about, catastrophic category. 1% of the population, they have claims, they generate claims roughly up to 15%. If the catastrophic impaired health groups were segmented into a separate insurance pool, all other groups will benefit with lower health insurance premium, folks. Yes, all other medical groups will be benefited with the lower insurance groups. This group would be provided proper care and treatment and given the state and federal premium subsidies for effective treatment, folks. The problems we have, the insurers are not segmenting the population. Their insurance risk is broad based. We need to change that, folks. We need to have it categorized into well group, at-risk group, chronic illness group, and catastrophic group. Then only you can broadly try to address the concerns and lower the premiums by taking extra precautions. But the problem lies where the politicians nor the insurance industry leaders are discussing risk segmentation approach. They're not even talking about risk segmentation. Why? Because it upsets the status quo. Some argue it is not politically correct and could stigmatize the high risk population. That's the problem. Because they're looking at stigmatizing at risk or chronic illness folks. But others say it's too much like the system we used to have it before Obamacare. That's what they argue. Politicians seem to prefer a centralized, one-size-fits-all approach. That's how we got the Obamacare single risk pool, with everyone lumped together based only on premiums, folks. Only on premiums, not on, it has nothing to do with healthcare. Nothing to do with healthcare. There is no one size fits all approach in healthcare. We need to get that fundamental aspect. We cannot have one size fits all approach for everybody. Healthcare is healthcare, you can't do that as one size fits all approach. A single risk pool system is where everybody's premium is based on everybody else health risk. So you will be paying for somebody else's health risks. You will be paying for drug addiction. You will be paying for alcoholics. You'll be paying for hypertensives. You'll be paying for diabetes. So even healthy people, healthy population will be paying for somebody else. There is no differentiation in health maintenance, lifestyle, treatment compliance, not even the age and gender, folks. Not even the age and gender. It doesn't matter what age you are, it doesn't matter you're male or female, your insurance premiums are broadly based without segmenting. There is no financial benefit. There is no financial benefit to be healthy with everybody lumped together. So there are no, if I'm healthy, I have no benefit whatsoever. If I'm taking care of myself, if I'm being responsible, if I'm handling my diabetes, if I'm handling my high blood pressure, it doesn't matter. You're everybody, you're paying for everybody. That's not right. That is not right. So, how do we open the minds to new ideas and innovative solutions, folks? How do we open the politicians and insurers with innovative solutions? You know, Newt Gingrich, former US House Speaker, used to say there are two ways to approach this problem, folks. There are two ways to approach that. Number one, no because, and number two, yes if. There are two ways to we can approach this problem. The no because people want to protect the status quo and their personal interests. That's what they want to do because they want to keep the status. They, that's how they. That's how it is. No, because people want to protect the status quo and they want to lump everybody together with a public option. That's what they want to do. No, because people, no, because mentality inhibits the debate about healthcare. It prevents brainstorming or considering alternatives. That's what it is. Yes, if person takes the same concern, and finds a solution. Yes, we can do it. We can do this. That's how we need to address this problem. If you're a yes person, you can gain control over your health insurance needs, and it could be a matter of life or death for you and your family member, folks, for you and a family. As a consumer, as an American, you have a right to be grouped with others with similar health risks. Good or bad, it doesn't matter, good or bad, but you have a right to be grouped with similar health risk. That's a fundamental aspect of healthcare. Only then you will be able to get a relevant and timely information, appropriate level of coverage, and proper medical care at an affordable insurance premium, folks. That's the only way we can address this health insurance. We have all this 20 so-called 26 million Americans who are not insured, who have no insurance. We can address that very easily with the public-private partnership, folks. We can address people. If people deliberately they don't want to buy the insurance, there are consequences. There are consequences. They lose the exemptions when they file their taxes. So if the people don't buy the insurance, there are consequences, folks. So it will discourage from people not having insurance. And public-private partnership focuses on the most critical, most sickest among us. They can focus on people who are sick, who are impaired physically, who are economically impaired. They can focus on, actually, it's only 2 to 3% of the entire population. We have an issue. You mean to say America cannot take care of the 2 to 3% of the folks which they really need to be addressed and solve the problem? Yes, we can. But we need to open our minds, open the debate how to fragment this risk, bring the premiums lower, incentivize the incentivize consumers to have a personal care accounts, so where it is has to be a consumer driven personalized healthcare with incentives and rewards. That's the only way we can solve this problem, folks. Otherwise, even after spending $3.7 trillion, we still rank 37 among the most advanced countries in the world, folks. This is shameful. This is shameful and unacceptable. And people want to have one size fits all approach in healthcare. Doesn't make any sense. Why should I be paying for somebody who's irresponsible on their health? Why should I be paying for somebody else obesity? Why should I be paying if somebody else doesn't take care of himself? That's not right. That's not right. We need to focus on individual freedom. We need freedom in healthcare, folks. We need total freedom in healthcare. It has to be consumer driven, it has to be demand control, where consumers will demand affordability, competition, and transparency. Right now, healthcare is going in the wrong direction. I see a lot of consolidation among the hospitals, lot of mergers, lot of group mergers that discourages competition. We need more competition, not less competition. We need less consolidation. We need less and we need to have a tort reform for healthcare professionals so they can take care of malpractice claims. They need to be, even for healthcare facilities, we need to have a tort reform. And so-called we Medicare, what we have was originally passed in 1964. 1964 with a basic insurance, folks. It has not been reformed or changed since 1964. We are still stuck at the basic insurance. So if you get hospitalized, if you have no other insurance, you end up paying $1,400. People can't afford to pay that. And after 60 days, you end up paying $350 per day, $52 per day. After 90 days, 752. Those kind of issues can be resolved, folks. There is a way to resolve it, because the hospitals are reimbursed not by the number of days, they are reimbursed by the DRGs, diagnostic related groups. They're not reimbursed by the by the number of days in the hospital. So there is no reason to charge the consumer for hospital stay and after certain period. Like large employer groups, we need to adapt to the just like the larger employer groups, they have self-funded health plans. Medicare can do the same by having personal care accounts. They should be able to take care of senior folks. We should be able to handle their own health if you give them the tools, folks, if you give them the tools. Well, that's the way it goes. Risk segmentation is so critical. We need to have the Medicare, so-called Medicare Advantage. It's not Medicare. People don't know that. And they think they have Medicare Advantage is a private health insurance carrier doing the job of Medicare, and they collect the funds from the Medicare. But if you give the same tools to the individual consumer or individual senior, they know how to take care of themselves, folks. It can be done. Medicare needs to be empowered to every senior. If AARP is listening, AARP needs to demand that instead of there's no reason to have a supplemental insurance coverage. Give that money back from Medicare to every senior. Let them choose what healthcare plan they want. Let them choose their doctor. Let them choose their hospitals. That's the way it should be. We need a total freedom in healthcare, folks. That's the only way we can bring down the costs. Thank you guys for listening. I'll keep bombarding the same issue over and over again till everybody seems to understand where the problem lies. The problem is how we open our minds and segment the risk. Premiums are based on the risk, not on broad population like what we have. That insurance companies have to change and modify. Premiums have to be adjusted according to their risks. Thank you. Thank you for listening. This is Foremost Organization, so-called personalized healthcare, consumer-driven healthcare. On the behalf of Foremost Organization, we salute you. Thank you very much.